How can we get the quickest pain relief and whiplash recovery? The key is specific Arthrostim adjusting techniques. Dr. Michael, Key West Spine and Injury, Key West's largest auto injury rehab clinic. The safest and quickest relief from whiplash injury is through specific corrective techniques utilizing the Arthrostim adjusting instrument. The Arthrostim has different frequency settings depending on the use. There are settings for muscles, discs, and joints. Today we'll be demonstrating its use for joint mobilization or adjusting with a 6 hertz setting. First, I want to demonstrate a shared loading adjustment. What we mean by this, we're going to work on creating a normal curve in our neck. This is an extremely common adjustment after whiplash, or even for people that have spent too much time looking down, texting, or working on the computer. Next, let's look at some more specific misalignments and corresponding adjustments. The occiput, or backbone of your skull, will often be an extension after whiplash as your head is trying to right your eyes, something in neurology called the righting reflex. So the corrective adjustment here is to flex the head and using this wide tip to get a good contact on the occiput, drive that into flexion to correct. The first vertebra in your neck, C1, commonly referred to as the atlas, should be parallel to the occiput. This is also most commonly stuck in extension fixation with a whiplash injury. We're going to use the same tip so we can get a good contact on the sides of C1 here, and again, correct a flexion motion to correct. Moving down to C2, the axis, you can see that here is this posterior tangent line is leaning completely the wrong way. We're going to change tips again and use this one to create a contact right here on the C2 spinous process and drive this in this direction, creating a rotation around this axis. The trick with this one is it's difficult to maintain a contact, so I have to hold it in place with my thumb here, so I need some assistance from the patient with this one by simply asking her to look all the way up to the ceiling as we correct her C2 misalignment. And those are some examples of common misalignments found with whiplash and the corresponding Arthrostim adjusting techniques. I know this may have been a little more technical than other videos, but hopefully you got a lot of value out of this. So please give us a thumbs up, comment, subscribe, and as always, most importantly, if you know someone that's been injured in a car crash or needs to hear this information, please share this video with them. Dr. Michael, Key West Spine and Injury, Key West's largest auto injury rehab clinic. Have a great day.